So this is the last session of the day, and it's been the packed day, we know that. At the same time, I feel that we are now getting to the ground matter. It's not enough to allocate money, it's also extremely important to look at whether it reaches where it is supposed to reach, and that's the topic of this session. And it's something which, surprisingly for sector people at least, is often somehow overlooked. And if you look at the PFI indicators, for instance, it's quite striking. There's just one indicator which is measuring that somehow. It's not only overlooked, but also got a feeling that communities look at it quite differently. And that's one of the things that we're going to hear about today. Some of the speakers are coming more from the sort of sector point of view, the service delivery point of view, and then we have one discussant who is actually coming from the Ministry of Finance point of view. And so, whereas both of them are interested in this issue, which is like ensuring predictable funding to service delivery facilities, they're aware of the challenges, but they're looking at it from different angles. So it's again one of these issues around which what's needed is finding some ways of dialoguing around that and building bridges between these communities. Predictability can be thought of in different ways. It's about stability of budget plans over the years, but it's also about the credibility of the annual budget and the timeliness at which resources are actually reaching where they have to reach. And there's obvious evidence that many countries have problems with ensuring one or the other or the three dimensions of this predictability issue. Bernard is going to give a lot of examples, so I won't go into the depth, but let's say, for instance, when you have studies showing that just 1% of what schools should receive reaches the schools in Madagascar at the beginning of the year, there's a big problem there. It does raise huge challenges at the level of what the school should be doing, what the health center is supposed to be doing. So we're going to hear about these two perspectives, the perspective of the service delivery and local government trying to provide the services and manage them, and the perspective of the ministries of finance. And I have three speakers to discuss the first perspective, and then one discussant to sort of bring the other perspective into light. Now, I'm confusing my left and my right, so sorry. There, that end, I have Dr. Bernard Gauthier, who is a professor in the Department of Applied Economics at the École des Hautes Études Commerciales à Montréal, at the University of Montreal. He's an expert in public expenditure tracking surveys that are still some of the best tools, actually, to provide the most compelling evidence that schools and health centers face predictability issues. Bernard is going to present some common findings from these studies to help set the scene for this discussion. Our second speaker is Dr. Dorcas Kiwanuka Henriksson. She's a research coordinator at the Karolinska Institute in Sweden, but she's also a medical doctor and public health specialist, and previously worked as a district health officer in Uganda. So it's a very grounded experience that she's going to bring into the discussion. She's continuing to do research on health systems in Uganda, and she will present some of her reflections on the way unreliable fund flows and the conditionality, which is an interesting aspect as well, affects district service delivery. Our third speaker is Dr. Benjamin Tsofa. He's a principal research officer and deputy director at the Kenyan Medical Research Institute. So we stay very much in health, but some audience people and myself might bring some education perspective in there. And I'm going to ask Dr. Tsofa to tell us about the design and the implementation of one mechanism that Kenya put in place some years back, direct facility financing, and how it evolved with the big decision that was taken in 2010 and implemented since 2013 to create this set of new fairly autonomous county governments, how that changed the setup, really. And as I said, our final discussant is Marcel Mukeshimana, who is the Accountant General for the government of Rwanda, as you heard earlier. Rwanda, we know all that it's very famous about the sort of pace at which it's implementing governance reform, including PFI reforms. But it's still also a low-income country, and like many ministries in many countries around the world, they're facing constant challenges balancing fiscal and fiduciary controls with the demands to deliver against very ambitious and driving performance targets in an environment where that is very important. So Mr. Mukeshimana will reflect on how the ministry the Ministry of Finance and Economic Planning in Rwanda managed these challenges so far, and what opportunities he sees to improve fund flows to service delivery facilities. So without further ado, I'll ask Bernard to set the scene for us.
Thanks a lot, Catherine. I will just give a very rapid overview of these specific tools called the PETS, the Public Expenditure Tracking Surveys. I'm sure a lot of you already know about these tools in your different countries or different past experiences. It will just be like an overview of some of the main findings, a little bit about the usefulness and some limitations of this tool. So it's a very specific monitoring tool that has been devised, which basically tries to strengthen the relationship of accountability between the budgeting side and the public expenditure and providers' performance. So we're trying with the PETS really to trace the flow of resources from through the different government administrative system down to the providers and final users, and the key issue being to try to determine the various bottlenecks, various shortcomings in the public expenditure and the service delivery process, and especially also to try to assess if funds are used as intended by the budget, by the government. And since their creation in Uganda, it was first applied in '96 in Uganda. They have been implemented in more than 60 countries, typically within the sector, at the sector level, health and education especially, but also in agriculture, water, etc., but also to track specific social programs in various countries. So the PETs are basically complementary to the more central level type of tools such as PR and PFI, and they try to focus then on the subnational but down to the service providers, and to try to move from the official budget figures to effective budget figures. So through in the flow of from the policy process down to outcomes, the PETs are very often combined also with the QSDS, with the quantitative service delivery surveys, which are collecting more detailed information about the providers, characteristics, activities, etc. And they are also complementary to SDI, to service delivery indicators, the new indicators at the World Bank. And so these tools, I mean, have been used especially to try to, as I mentioned, to identify various type of bottlenecks, shortcomings in the inefficiencies and inequity within in terms of actual allocations. Among the key findings, some have been about leakages, about delays, about inequities. I'll just mention show you a few examples of that, and as well as about informal payments, high user fees, different types of shortages in drugs or textbooks, etc. And overall, like various different problems of accountability, information asymmetry within the system. So in terms of leakages, just one example of that in terms of the importance of looking at effective transfers, effective allocations of resources. This is for the Philippines, and it's a 2014 PETS. And we have the central ministry. It was the tracking was done on one fixed allocation rule, which was actually the maintenance and operation budget, which was a fixed earmark transferred to the schools. And from it represented about 68% of the school, the ministry budget for the recurrent budget, non-wage for the primary and secondary schools. And basically only 77% of the transfer reached the schools, and about 16% of that leakage or that capture or that non-transfer was because of the Central Ministry of Education was not transferring the allocation to the divisions, and then the divisions, another 7% was not transferred in percentage point to the schools. So that's for the Philippines. In Chad, that's a few years ago in 2004, it was a PET in the health sector this time with a discretionary allocation. So there was no earmarked transfer except down to the provincial delegations. And here, we had the regional health delegations. So there were 14 of them in Chad, and in red you have the actual allocation, and in blue, the initial official allocation, and in blue the actual allocation that was reaching the regional delegations, and basically, and in yellow it actually is the percentage. Basically, about 27% of the transfer was reaching the provincial, the regional delegations, and so basically 73% of that was captured or was not transferred by the central government, and then from the regional health delegations down to the health centers and hospitals, we could only measure 1% of the central government health budget toward that was reaching the primary health care facilities. So this was very high level of leakage. This in Morocco. The tracking was done in 2011 on actually the 16 main drugs sent from the central pharmacy, or the procurement department in Rabat to the different provincial delegations. And this is different from the previous one. This is actually the percentage of leakage out of this of the value of these drugs, and in blue it's the leakage rate from the ministry of the central ministry, the central pharmacy down to the delegations, and in red it's a leakage, the percentage not reaching the pharmacies at the PhD level in the hospitals. So basically it was about 70% of the value of the drugs were not accounted for in the hospitals and at the provincial level, at the PhD level, from the main drugs sent from the central pharmacy. So this is for Morocco. In Nigeria, there was a complex tracking. That this is the flow of funds toward the PHCs so it's a federal system there's no allocation rules. Toward PHCs, it's basically discretionary from the federal government, also from the various provinces, and as well from the local government administrations down to the PHCs, the primary healthcare facilities, and basically, so we tracked. It was in 2015. Giving the very enormous problems of information within the system, because there's no accountability also from at the different levels toward the federal government or toward the provincial government. There's no standardized or mechanisms to collect information, and also at the PhD level, the information is very inaccurate or lacking. So basically, what was done, it was a different public expenditure tracking approach. It was done instead of done retrospectively based on records. It was done continuously. Based on real-time basis so it was done in 2 states for 6 months to continuously track actually all the flows of financial in kind, and basically the results was that when we look at the share of expenditure for primary health care. So the key was that to try to assess the primary health care transfer, and basically about 50% of the budget, both including or excluding salaries, yeah, excluding salaries was actually supposedly transferred for primary health care, and ultimately only 1% of that transfer was observed or accounted for at the PHC level through this continuous tracking. So this is to say that basically there are different types of leakages, very important leakages in the systems. These tools are also adequate to measure different types of delays or unpredictable transfers in the system. In some states, again in Nigeria, in one of the states there was a 3-month overdue payment of salaries to the health employees in the health centers. So there are different types of delays that could be measured with these tools, as well as we were discussing this morning a little bit equity issues. So these tools are also equipped to measure inequity within the actual transfers toward the variation could be very substantial in terms of these inequitable transfers. And so, but these tools have been, there are various criticism about these tools in terms of, especially some about methodology, but also in terms of their capacity to bring changes in terms of policies. And to that, the key things, let's say, to improve the process of obtaining results, basically, obviously, is to build ownership at the government level, commitment, also potentially ex ante in terms of the reform process, but also basically ensuring dissemination of results, ensuring participation of the population. But also, instead of doing standalone studies, to embed these type of surveys within a multi-year repeated process to track the policy reforms, and potentially currently also to integrate these type of studies with SDIs, with service delivery indicators type of surveys, which are more focused on school level, and to identify in their service delivery these different types of bottlenecks. In terms of the future, also, there are issues of harmonization of these tools, making sure of the methodology could be reconciled across countries, but also over time to have adequate indicators to follow. I was mentioning Nigeria with the continuous tracking, so clearly this is in situation of very poor information, that it's an approach that could be followed. And also, tomorrow there will be discussion about new technology. Obviously, with pets, there could be what we could call e-pets, like with electronic tracking technology that could be used to, in certain sectors, that's in pharmaceutical, to have traceability, to have there are very important leakages in the sector. So new technologies, information technology with tracking, tags, etc., could be devised to measure these type of capture and to ensure more equity and efficiency within the system. So this is a very rapid overview of these, one of the tools that could be used to have more effective data about service delivery.
It seems to me that it's indeed one of the tools in the toolbox that it's very good to talk about a bit more. We now have Dr. Kiwanuka Hendrickson. So she's going to talk about the Ugandan health system, which is largely funded from donors and conditional grant from the central government. And there is a history where it's been delayed at times, but there's also a history of improvements and a history to tell around the earmarking of these funds. So please go ahead.
Thank you, Catherine. I think that there's no doubt when I say that governments face challenges of making sure that financial resources get to where they are needed. And Uganda is not an exception to that. And I will speak from the health sector perspective and the health system. And in Uganda, as previously mentioned, it's a decentralized system. And therefore, the district health system is a self-contained segment of the national health system. And at this level, planning for intervention takes place, and also service delivery takes place. And we have heard from Kenneth and other speakers, and also Catherine mentioned, that Uganda has made a lot of progress over the years across the board, not only in the health sector, where we've seen improvements in health outcomes and indicators right from infant mortality, also with maternal mortality, although still we have a long way to go. And also the way finances are transferred, they've gone through phases where it has been better and then, worse, and different periods of progress have been made. I will speak to some of my experiences, both through the work that I have done in Uganda at the subnational level, and also a little bit working within that kind of system and environment. One of the studies that we conducted, just to put it into perspective, was one that was trying to look at possibilities of building the capacity of district managers to use their own information or context-specific information to set priorities and decide which interventions will actually get the best results, and use this process to inform the decisions in the planning. And this was done with a focus on child survival activities. So a set of tools were introduced to the district managers to help them analyze some of the data. And some of the data that was necessary wasn't available. So parallel data collection was done. And I think we've all heard about the gaps in information that sometimes constrain decision making. So I will share some of the perspectives specifically related to financing, but there's several things that are cross-cutting, also related to service delivery, and I will touch upon a few of those. So firstly, I think this is a repetition of what everybody has said, just the sheer inadequate levels of funding. So I will give an example of the districts that we did a work plan analysis on, and this was specifically looking at child survival activities. And over a period of 4 years, so we took annual budgets for 4 years, in these districts, the per capita funding, so this was in the plans, so we didn't know exactly what actually ended up in the district, was between 0.02 and 0.3. So, I mean, you can see the level of funding. It's very, very low. And these districts were selected because of the poverty levels and also because of their poor morbidity and mortality indicators for child survival related services. So that I mean, I cannot underline it more. But on top of that, these funds that were really very small were not necessarily received on time in several of the districts, and there were several delays, which made funding very unpredictable. And in Uganda, we have, I'm not sure the number of districts right now, but
70 something.
Yeah, they're over 170. So, I mean, for me to sit and generalize for every district is really not possible. So the districts have increased exponentially within a very short time. But generally speaking, many of the districts we visited had unpredictable funding. And this was disruptive, not only for service delivery, but also the incentive to actually use the tools, because the tools that we introduced, although they were not very complicated, meant that they had to set aside time to actually look at their information, not the usual way that it was done. You collect some data and you aggregate it at the facility, move it on to the next level, it's aggregated, it goes to the ministry, and you never really analyze it. So it took some time out of what they were used to doing. But if the funding is unpredictable, at the end of the day, they're like, why do we have to bother with this kind of thing? And I think it's also an argument in this setting where you have very meager resources, actually use them in the best way that you can. So unpredictability affected actually the use of the information that could actually be done even at that point. And thirdly, in the districts we looked at, approximately between 47 to 97% of the funding for child survival activities came from donors. And many of the times, the donors had their priorities already set, and sometimes they would be in line with the district priorities, sometimes not. But even in some districts, there were geographical areas where service delivery was to be provided with this funding that the districts received. And to some extent, these priorities were negotiable depending on the funder, depending on the district health officer, what capacity and capability they had to renegotiate the funding that came from the donors. But this was very different. Last but not least, the funding that came from the central government was earmarked, and we've had this a lot. And it was difficult to reallocate this funding. And therefore, much as you encourage the district managers to set their own priorities, different from those that are the national priorities, the only public funding, not most of it, was earmarked. So in the end, it's why do we have to bother looking at our own priorities when we can't really do much about it in terms of service delivery, because we do not have the funds to actually do this. I mean, that said, there were a lot of improvements from this process, where the use of the context-specific information led to dialogue by the district managers in a more confident manner to the donors. And in some of the districts, we actually saw that priorities were shifted because the managers had the confidence, because it was backed by information, to say that we need to do A instead of B, we need to go to this sub-county instead of this one. So in a way, it was a step forward to the use of the funding that they had, but because they had the capacity then to actually argue for reallocation of this funding. So I mean, in the context of PFM, we need to get resources where they're needed, irrespective of these challenges. And so we need to look at this fiduciary control that we have from the ministries of finance, the flexibility, or perhaps that's not the way to go, and really look at moving the decision making for resource allocation closer to the people who do the service delivery, in this case to the district managers. But also, as it has been alluded to by some of the speakers, looking at the outcome or the impact to the beneficiary of these resources. So in the health sector, we've been looking a lot at nominal coverage, so the capacity for service delivery, and not really the effective coverage, which looks at the quality of service and how much impact it's actually creating to the beneficiary. I know it's complicated, but I think that we need to move to that step now that we have the opportunity where these tools are gaining a lot of attention. But also in low-income countries, we can't run away from the fact that between 40 to 60% of service delivery is from the private sector. So how can we use this PMF and harness that proportion that comes from the private sector? So I think that we cannot ignore the private sector, especially in low and middle-income countries, where they account for most of the service delivery actually in some of the countries. And last but not least, I think when we talk about service delivery, even if it's for health, it's complicated. It's a complex playing field. And even when we talk about PFM, we need to to acknowledge the complexity. Even if we're looking at service delivery in health, there's several systems, not only financial systems, that will affect service delivery. And we've heard about the political system, leadership, we heard about human resource. So how do we capture this complexity only within the health system, but also across sectors and between sectors? Because health is not only determined by the health sector, but by education, by water and sanitation, transport, and so on and so forth. So as we move the discussion, we need to look at the complexity at the level where service delivery takes place. Thank you.
Can't agree more, I'm afraid. I'm going to pass to Dr. Tsofa, who, as I said briefly, is. Do you want the mic? Mm-hmm. And the clicker as well, I think. The clicker for the, yeah, there you are. Who is going to talk about financing health facilities in Kenya. And the two sort of big topics there are the direct facility financing, but also this new county governments, and how that's kind of interacting with each other. Please go ahead.
Good.
Sofa.
Good. Yeah. Thank you, Catherine, and thank you, colleagues in ODI, for inviting me to come and share the experiences we've gone through in Kenya in trying to struggle to get money where it's needed within the healthcare sector. The story I'm going to summarize really in about 6 or so minutes. It's been a journey of more than a decade, actually, really. So forgive me if I kind of browse through very quickly some of the details. But I mean, the rationale and need for getting money to where it's needed has been made in this conference, but has been made over many years in several discussions. And I think I don't want to dwell into that because I'll be like preaching into the choir in this meeting. But specifically, though, for the health sector, one point I would want to underline is inability to get money where it's needed in the front line and service delivery front line in the health sector actually affects quality of care, and that's a matter of life and death for some people. And interestingly also is that actually the things that are needed for the money at the front line sometimes are very, very small, low-cost things which have a very big impact on quality of care. So it's things like a facility manager being able to have little money to pay their water bill so that they can have their running water to be able to wash their hands in between patients, or things like being able to fuel a motorbike to trace defaulter within their locality. So it's really, really small money to do very, very small things, but the money is needed when it's needed, and when it's not there, there's a complete breakdown in the quality of care. So that's by way of background. Then also just a small thing to note, probably not many of you are familiar with Kenya, but the government that came into power in December 2002 that replaced the Moi regime, that the Kibaki regime, end of December 2002, did ride on a campaign for universal primary education by 2003. And true to it, immediately, 3 weeks after they were elected, there was the beginning of the academic year, and the president then directed that all primary schools should not charge fees, and government or treasury should send money to primary schools without systems, without structures, and it was described as chaos at that time, but it was actually done. So it just shows the importance and need the importance of goodwill and political will when you need to get money to where it's done. So based on the experiences of the education sector between 2003 to 2005, the Danish Agency for International Development, DANIDA, working with the Ministry of Health, actually found it very interesting and decided to pilot a similar model for health facilities, particularly primary health facilities within one of the regions of the country, the coastal region of the country. So this pilot was done in about 7 districts of the coastal region, and it was modeled around within a similar model like what had been used in the free primary education model, which was getting monies directly to health facilities, bank accounts, and those facilities working together with facility management committees, which were basically made of community members within the catchment area, will prepare work plans, then execute the budgets, and prepare, then account for that money to local district mechanisms. So this idea was to kind of bypass the existing district bureaucracy, financing a bureaucracy, and just get money to where it's done. So that happened in 2000, was rolled out in 2005, and in 2007, our research group was invited to actually evaluate, to do a post hoc evaluation of the pilot experience at the cost. And quite a lot of interesting findings came out from our evaluation. But basically, to sum it up, is the intentions were actually achieved. And the intentions were to get money when it's needed, and it was very little money, but get it to health facilities when it was needed, encourage community participation in decision making, encourage transparency and in the use of the money, and by that, doing all that is improve uptake of health services. So the conversation that came up after that pilot following our evaluation actually led into a nationwide conversation that led into a decision to scale up that intervention at national level. So towards end of 2007, actually the National Parliament passed a law to entrench what we call the Health Sector Services Fund, which was basically a funding mechanism now to fund health facilities directly directly for operations and maintenance costs. So then we were involved a lot in the design of the national scale-up after the law had been passed, and then a decision was made to do it to implement it in a phased approach, which was started at, or rather the phasing started at different levels of the health system. So rather than starting with all health facilities at the same time, it was staggered first at hospital levels, and then health center levels, and then finally dispensaries. So by 2010, actually all health facilities in the country now were receiving monies directly. The model is the same. Each one of them would have a facility committee made of people from the catchment, community members of catchment area, then working with the facility executive, who is the in charge, and the management team. They will prepare work plans and budgets, and they will get money directly from national treasury into the facility bank accounts, and the district level or district managers would only play an oversight and supervisory role in managing that. And it worked quite well. But as fate would have it, sure, a number of you would know, is around that time when we were achieving now total coverage of the direct facility funding in 2010, another big political activity happened in the country, probably purely based on completely different political push, which was the adoption of the new constitution. And within that new constitution, a key feature, a governance feature that was adopted was the introduction of semi-autonomous county governments. So these semi-autonomous county governments were to come into effect in 2013, and basically they will be semi-autonomous in the way that they will be elected directly by the people. They will get block grants, which is non-discretional funding from the equitable share from national government, and also levy local revenue, and decide on what to invest in where. But of course, within that constitution, also the mechanism for national government to provide additional funding to counties for some earmarked services. So those of us involved in the governance space, health sector governance space, or public finance space, anticipated some bit of chaos by 2013. So we started a lot of conversation on how to entrench and basically ring fence the direct facility funding post-devolution. And of course, I mean, as you predict, of course, that wasn't really a key priority, especially for the political class at that time. But also, interestingly, even for those of us within the health sector, there was a lot of lack of agreement of what mechanism to use, or what legal mechanisms to use to entrench or to kind of ring fence the direct facility funding. And so hence, when we went into devolution, some of the major players who were supporting this disagreed on how monies would go. So as at the beginning of devolution, there was actually complete disagreement by the key players, including those who was putting money into the initial basket, the health services fund basket. And so these bodies, some of them agreed to send money directly to the facilities, others, because the constitution acknowledged counties as the only accounting entity, decided that they will send their monies to counties, and the counties will decide. So in that way, we moved into 2013 and started noticing across the country recentralization of routine finance management in health facilities. We've documented this. But interestingly for me is, especially following up this post-2013, has been the quite wide variation across counties within similar laws about how devolution has affected it. So some counties, using similar PFM, the existing PFM activities, actually went ahead to strengthen what was there pre-devolution. So actually started sending more money to health facilities. Other counties reversed and moved all the finance management responsibilities to county treasury. Other counties decided they are going to set up county-level subsidiary legislation for them to be able to send money. So it's basically different people, different counties using similar environment or legal environment, interpreting things different and doing things. But I think also key among those is some counties who actually did subsidiary legislation to send money to health facilities, and several years down the line, they have not been able to send that money down to health facilities. So as I conclude, I think for me, my reflections and lessons from this experience has been that public finance management within the health sector, or getting money to where it is, goes way beyond kind of legalistic or legal and policy tools. It really needs a lot of understanding of what services need to be done and how to facilitate those services to be done, and empowering the people who are charged with those responsibilities to be able to do that. And once you do that, then that's when you work backwards and develop the legal tools or policy tools to facilitate those. So I leave you with these two quotes, which is actually, this is part of our long-term tracking. Some work data we're collecting end of last year, actually. And these are just reflection contrasting two different counties about the experiences. One county where they've managed to continue entrench direct facility funding, and one that has completely reversed the gains of direct facility funding. Thank you.
Brilliant. Very interesting experience, I think. All three, actually. But then now we really need to hear from Marcel. One thing which struck me in what Bernard said earlier, only one of many things, but one, was that 70% was captured or not released. The reasons for that can be very, very different. And I think that's where you come in. So please go ahead.
Thank you, Catherine. Also, my thanks to ODI for inviting me here. Actually, it's very difficult because I seem to be the person who was pointed. Every panelist was pointing cash should be released on a timely and when it is needed and where it is needed. But what I wanted to share with you may be from even the morning discussions. I may need to start with actually the proper planning. For me, it's something that touched my mind since I've been the accountant general, because I'm in between the upstream and downstream, where the planning is needed, then the software they are used. So the first thing that my country has done was to come up with the vision. So everything that we're doing is done in accordance with the national vision. So since 2000, my country has implemented what we call Vision 2020. So that vision has provided clear objectives where the country needs to be from 2000 to 2020. And that vision was looking to ensure that Rwanda should be coming from the lower to the middle income country. So different strategies were put in place, including the poverty reduction, the economic development, and the poverty reduction strategy. Currently, we're implementing what we call National Strategy for Transformation. So during the development of those strategies, what is clear and what is done by each and every sector is that each sector, including the health and the education, they come up with clear objectives. So we have sector strategies, which informs the national strategy. But again, those strategies are linked with the national strategy. So it means that you can't come up with priorities which are not part of the national strategy. At the end, national strategy should be the guiding principle. So apart from sector strategy, we have what we call the institutional strategy. So from now the sector, we have the institutional, where you come up also with the strategies that you want to implement. So you've got the goals, you've got the targets, you've got the indicators that you are going to work toward the medium-term period. Not only the strategy, but also what we've developed is what we call the result-based framework. So it's not only to have good targets, to have good results, to have good goals, but you need also to be accountable for what you are coming with. So the result-based framework has made everyone to be responsible with his or his own activities. So we introduced what we call the performance contracting, where everyone in the government, not even in the government, even in the private sector, even at the household level, they sign performance contract. How does it work? So since all of us we have the national objective that we want to achieve, then it's cascaded down in the vision or in the national strategy. Then down there is sector strategy, then district strategy, then institutional strategy. Then those indicators, goals and targets are substantiated to everyone. For example, if I'm an accountant general and I have to ensure that the PFM reforms are working, so I have a performance contract every year which I sign. Then my performance contract affects the permanent secretary. Then the permanent secretary also gets his performance contract, and the performance contract of the permanent secretary affects the performance contract of the ministry or the minister. So it means that those indicators that we want to achieve and should be achieving are cascaded to everyone, including the individual working in the Ministry of Finance. Not only the Ministry of Finance, even any ministry. Then the issue becomes now how those agreeing on the principles, target, and the goals, what is done. So we have what we call the consultation mechanism. Consultation mechanisms are done at all levels. It's top-down and bottom-up. We have donor community, we have household, everyone participates in the consultation process. Then once the consultation process have been concluded, so it's when we finalize the planning phase. So at the end, we've agreed on targets, we've agreed on goals, then we go to the financing or the budget process. So the budget process becomes very smooth because you've agreed on the priorities. You know each and every priority that you are bringing on the board should be part and parcel of national strategy. Now financing becomes very easy. A project which is not feasible, which is not linking to the national strategy, is not funded. So you may come up with a good project, you are a minister of a particular ministry, but when that project is tested, it's not feasible, it's not achievable, does not have any direct impact on the national agenda, it's not funded. So the budget process itself becomes very easy because the planning process has already concluded. And it's very easy because now the Minister of Finance, it's not only the Minister of Finance, it's the Minister of Finance and economic planning. So everything is housed under one roof and the monitoring becomes very easy. Then the morning we talked about the evaluation, or not the morning, the afternoon session, the evaluation. So evaluation, it's also linked to the performance contract that you signed. Everyone who signed the performance contract has to be evaluated. Say, for example, I give an example of household. It's very easy. The household, the performance contract of household, they are basic. It's cleanliness, it's health, because everyone is interested. So if it is cleanliness, you need to clean your house. If it is education, you need to ensure that your kids are educated. You need to stop or to prevent the dropout from the school. So those ones becomes culture to the extent that everyone working within, yes, yes, thank you, also is monitored and is evaluated. Then finally, the key question that we asked now, money. So the financing of the budget is something that is very important. And what we've been doing, how the budget is financed, is very important. From 2000 to 2020, our budget was financed. The large share of the budget financing was external resources, even grant. But to date, national budget is financed by domestic resources at 65%. Second, the priority is given to borrowing than to grant. Then thirdly, grant. So now your resources, the resources that are needed for implementing activities, you know that at 8% or 85% are predictable because either it's your own domestic resource or it's the external borrowing which you have control. When it comes for grants, again, donor don't dictate what to be financed. We have what we call the division of labor. So I know there are sectors like health and education which are very sweet for different donors. So what is done for us to allocate sectors to every donor? If it's World Bank has preferred to go to education, you will not go to health. So the health is given to someone else. Then at the end, you find all sectors are benefiting equally. Then finally, the donor is not financing his agenda. He finances the government agenda. So allow me 1 minute to talk about now the decentralized units. Back home, we have central government and we have local government. Provincial is not, it's not another level of government, but at province level, what we have is just the monitoring and the evaluation of what is happening at the district level. So if we take the example of the education, the schools and the health facilities, all those are decentralized at the level of the district. However, central government is still active as far as the education and health is concerned. Technically, Ministry of Health supervises what is happening at the level of health facilities. Ministry of Education supervises what is happening at the level of schools. Ministry of Finance, as far as the public finance management is concerned, also supervise what is being done there as fiduciary assessment. Then the district, they are in charge of ensuring the administrative process are working. So when it comes for resources allocation to the centralized units, we have the Yamak transfers, which is common to everyone. We have the block grant. Then they have their own resources that are generated at the local government level. So when it comes for block grant, in the past we used to face challenges of releasing funds on a quarterly basis. But what came out is that those funds that are meant for service delivery, you can't delay them. So what happens is we try to bring or to differentiate between the block grant with the capitation grant, which are needed at school. Then they are released as soon as they are requested. Number two, teacher salaries and health workers' salaries. Those ones are paid even before 20th of the month. If it is delayed, even the mayor of the district may be sacked because that one is more of, is touching the service delivery, because a staff who is not motivated, you can't deal with that person. So the salaries are paid through central treasury, but are committed by the district. Then when it comes for your marketing transfers, those ones are transferred from treasury to district, then implemented at the service delivery units, and at the end we installed accountability mechanism which goes up to the level of service delivery. Auditor General is in charge of auditing central government, local government, even goes down to service delivery unit. So system that we use at central government, IFMIS, is also used at district level and it's used at sub-district level. So you find health facilities are enrolled to IFMIS. You find schools, they have an automated system that is used. Then at the end, for us, it becomes easy to implement the PFM controls and assure accountability at the level of service delivery. Thank you.
Thank you. I'm pretty sure there will be more questions about how it actually works. But basically, there are a couple of things that struck me, and then I'll open to the floor. First, if I can remind you, this is live streamed, and please feel free to tweet whatever interesting thing you hear. The first thing is that we heard a lot about, in the different sessions actually, about the link that would need to be made stronger between PFM outcomes and service delivery outcomes. And that, I think, is something which I thought about as sort of a possibility of strengthening the convincing power of pets, if they could be also linked up with some kind of outcome toolbox, sector outcome measurement toolbox, more systematically, which is a bit what you're saying about embedding these ones. The other thing we heard is that predictability is not enough, but some flexibility in how you can use the funds. And that, I think, is a very, very tricky one, because we also heard from both of you, I think, that somehow what gets prioritized in terms of releases is actually the earmarked money and less the sort of non-earmarked money. And I would say that this is raising its own challenges. Now, let me leave it at that and open the floor to some questions. So there's one there. At the moment, only one. Let's start by there. Raise your hands quite high. Please go ahead.
Go ahead.
Yeah.
Thanks. Hi, it's Joshua Jackson from Crown Agents. I've done a lot of work in countries, in ministries of finance, so I've got some first-hand knowledge of cash flow issues, including once in Papua New Guinea, where I was on a committee that on a daily basis decided who got paid across the government. That was real crisis. But most recently, I've been in Sierra Leone and Zambia, where there's been a real issue of, which we would address in the program, about budget credibility and reliability. And the fact is that the governments in those situations are being over-optimistic in terms of the revenue that they will receive in that fiscal year. So you end up with grand budgets that can't be funded. And that's a real issue. And it's just trying to work with ministries of finance and politicians to try and encourage them to come up with more realistic budgets based on more realistic revenue projections, so that you can prioritize right up front, and then you could have more smooth service delivery throughout the year, rather than saying, health, you've got $100 million in your budget, fantastic, but then they only get $40 million at the end of the year. And so this is very important in terms of encouraging governments to come up with more realistic budgets, so you can have more smooth implementation and better service delivery. Thank you.
There was one question somewhere there. Yeah. You raised your hands.
Yeah, thank you. Thomas Freiger, I'm from the European Commission in Brussels, dealing with budget support and public finance management. Thank you for the very interesting presentations and also case studies from the countries. I have, first of all, a question with regard to the PETs, or several questions, in fact. One is more, you are talking about the leakages, and with partly quite impressive figures of leakages. How do you establish the leakages, and what kind of counterfactual or counter-checking process you have with the pets? Because as far as I know, I'm not an expert in pets, but there is not really the standardized methodology for pets that we have for other diagnostic tools in PFM. The second point is how far they identify avenues for reform, or at least, let's say, causes of leakages, origins of leakages that could help for identification of reform. And my third point is a bit your views on that. My impression is, I may be wrong, that pets were very popular around the end of the 2000s and around 2010, and somehow it seemed to me that in the recent years they have been used less, and apparently part of it is maybe also due to the kind of political nature, because it's very sensitive when you identify leakages. So how do you deal with that in terms of using them, or using them more widely, and also in a sense that can be channeled constructively and channeled into PFM reform processes?
Simon?
It's Simon Gill from ODI. I wanted to share one of my worst failures A great triumph, and I have a question. One of my things I regret most, when I worked for DFID in Tanzania, we spent a lot of money on an education pets. I think actually the cost was nearly £200,000. It did all the things that you expected a pets to do, and then it went nowhere because we'd had no political buy-in from the government, and in a way it was almost a waste of time. So I suppose the point I'm making there is, if you don't do that, it's a waste of time. One of my great triumphs, it wasn't really a great triumph of mine, but we did some work in Sierra Leone, probably, Joshua, about 2 years before you, and one of the great triumphs is we got the budget director and the accountant general in a meeting together. That's all we did. But the remarkable thing about it is they'd hardly ever met. And it was this point about budgets were being set which were way over the cash that the ministry had, and that was the thing. I'm amazed by Marcel's articulation, and I'm asking a question on behalf of Kenneth. Is it really as good as you say? And the reason I'm saying is it really as good as you say, because my question is, at a district in Rwanda, as well as money coming from the centre, they're also dependent on money that they raise locally. And if they don't raise the money locally, surely they don't have the money. So I'm really questioning whether it's as good, the story is as good as you're telling it. But maybe you can't answer that question. But anyway.
Yeah, and then Ratin, and then, or wherever. Yeah, but definitely Kenneth will get back to you.
Okay, just two brief points. One, this thing about pets and, raising uncomfortable questions. I have some input. We don't have to, we can do pets now in India, so we do it quite routinely. It's not called pets, but it's what they do. It's tracking surveys. And so one thing we found, which is quite interesting, remember in the morning I was talking about this big float. So what we found was leakage doesn't necessarily mean it's gone to someone's pocket. It could also mean sheer incompetence and the money stuck in treasury. So it's very important to give these messages out. It's not like, to a politician. It actually could be that what you'll find is your money stuck somewhere and you can unstick it and take it out. So that's, sort of one. The second is, since we have health professionals here, let me share something which is always unsaid. We all agree that we should improve healthcare and education, but I'll tell you what I did on education in India. I found it would cost us about 7% of GDP. I'm willing to be 10% wrong. It would still cost us 6.3% of GDP, okay? So I said, this is not, first to my wife and then to everybody else, this is not affordable. She said, of course, it's our children. And I said, yeah, but then what do I do about 2% of GDP defense spending? So you can't touch that. So I'm now falling between two very, between two stools. I'm providing third-rate education to everybody. I could have provided a better education to somebody, but I chose to provide third-rate education to everybody. It's a real quantity. And because I start doing that, I start building fantasy worlds in the Department of Revenue. Because I have to, SDGs are putting pressure on me, MDGs are putting pressure on me. Everyone is saying educate all your children to a standard. Civil society is there. So I go to Revenue and say, give me some bloody taxes. And they say, yes, sir, of course. And then they don't. And then it gets worse. Now, this is actually a very good example of this PFM interface. I'll be very interested in knowing in the course of this conference and from you how we deal with it. There's nobody responsible. But it's a collective sort of falling between two stools that we must avoid going forward.
Of course, my name is Kenneth Mugambe. Of course, Simon is trying to create an artificial conflict between Uganda and Rwanda. So I want to clearly state that I didn't ask Simon to ask the question. No, I think this issue of flexibility and predictability is actually critical. And I believe that is actually at the center of, the whole discussion or, the nature of the PFM system you have. Because if you have a strong PFM system, then definitely you can afford to allow a degree of flexibility. Because as a Ministry of Finance, then you are sure that these resources will be well spent at whatever level you are talking about. But the moment the Ministry of Finance doesn't have that confidence, then you definitely not be in a position to allow flexibility. So as we discuss, the extent to which we can allow flexibility and all those things, let's first look at the kind of PFM systems that we actually have. Can they guarantee, efficiency in terms of the resource use? Are we able to account for the resources? Are we able to put the resources to the right use? Whether it is our definition as Minister of Finance, but at the end of the day, there is some common definition of what, good use of the resources is. So that is really the point I wanted to make. Now, the second point I wanted to make is when you talk of PFM systems, there must be some other complementary systems that we are talking about. You cannot look at PFM systems in isolation of other systems. Now, if you take the example of Uganda, we do send medicine. The purchase of medicine across the whole country is centralized. Okay, so in terms of at that level, you can actually comfort yourselves as Minister of Finance that yes, I have provided 100 million US dollars, and this 100 million US dollars actually has bought the medicine. But the question is, does that medicine actually reach the service delivery point? How much of the medicine actually expires in between? How much of the medicine leaks? Even at the service delivery point, we have examples where small items, as gloves, for example, they reach, but immediately actually they reach, they are sold out. Or even the drugs, even where the drugs are embossed. So you must have a system, that is able to track that medicine beyond, a PFM system. Of course, in terms of predictability, I think the debate has now moved on because in our case now in the Ministry of Finance, we largely guarantee, the resources for the, local government level. Whatever money is put in the budget, both in terms of the timeliness, the time it takes, to reach the end user point, and also the predictability is largely guaranteed. So that is no longer, a big problem. But as I said, PFM systems must have other complementary systems to be able to become effective. Thank you.
Let me stop here for a first round, perhaps, and ask anyone among the panelists who want to start. Bernard, you had some specific questions, so maybe you can...
Okay. So first, in terms of the definition of leakage, it depends actually when there's an earmark or non-earmark type of transfer. When it's an earmark, it's easily done as the share which was earmarked, which does not for a specific target, which does not reach destination. For instance, a school grant or a specific health facility grant. But when it's not earmarked, then it's based on discretion. Then it's the rate, the share which is reported sent by, let's say, by the district level, which does not reach or is not accountable at the PHC level. So it's a difference between two segments within the delivery chain. So that's why when it's based on discretionary, so we need to have information on 2 points. You're referring to but when we measure that, obviously it's not necessarily corruption. It could be it could be other types. It's maybe fungibility type of behavior. So it could have been reallocated to a different sector. So these tools, these PETs are not audits, and they don't try to do complete reconciliation or identify where these non-accountable accounted for finances are used for. In a sense, but it's not just that a specific earmark transfer or some budget has not reached destination as it is reported that it should have been. The case of Tanzania is interesting. You mentioned it's Tanzania education, isn't it? So which year was because there were 2010. Okay, exactly, because we did actually also SDI in 2010 in Tanzania, which an element of pets in it. There was a pets module in it, but in Tanzania there have been actually 4 or 5 pets in education done, and each time from I think the first one in 1999, and I'm not sure when is the last one. But the government has been strongly rejecting the results, and basically the buy-in was not there at all. And so obviously there are two ways where government could be influenced. It's either through basic result facts and analysis, which would show them the right path, or through citizens or through elections. But basically it seems that these two two ways were not functioning in Tanzania, but also I would say one of the main problems with pets or other types of tools which provide strong results in terms of inefficiencies or various types of wastages or corruption is the buy-in needs to be done initially with, I think, by the donors or by the agency supporting these type of tools. I would to have a buy-in also from the sector, not just from Minister of Finance, but also Finance Ministry, but also from the education or health sector, for them to have some kind of commitment to develop an ownership about the methodology, the results, and for them eventually to accept the results and potentially put in some reforms, and then to track also the impact of these reforms. I would cite one example where something like that positive has happened with the pets recently in Thailand with UNICEF, actually, that was done in the education sector. And there was a strong buy-in done initially with the government, with the Ministry of Education, and actually they selected the tracking program, the program that was tracked, which was the main, the free education program for basic education. But there was a very strong buy-in, and following the results, they adopted several reforms in terms of increasing equity through increase the poor student transfer. There were reforms in terms of monitoring, in terms of guidelines. There were several important reforms done following the PET. So it's not always, but I agree that, and on the donor side, very often, let's say if it's the bank or other type of donors, DFID or UK aid, Australia aid or other donors, they tend to use it in a silo type of mode, and they implement the survey, and they don't use the results, or they don't really commit also on the donor side to use these results for, let's say in Morocco, when we came up with these results, there was a $200 million program in the health sector at the same time, but despite 70% disappearance. This was unaccounted for medication from the central pharmacy, and still the loan went through, despite these anomalies, very strong anomalies.
Do you want to comment on the point that? Oh well, he's not around. So let's wait he's back, and then we'll address that question. But then there were other questions that perhaps, well, there was certainly a challenge to you. Is the story as good as you told it?
Thank you. Actually, if I may try, Simon, there's a time that we worked together. Then I called him a philosopher, and said sometimes there was a more philosophy. But in the context of what he mentioned, I may say that maybe was looking, is there any pressure as an accountant general sitting in between national budget, the forecast? My colleague has mentioned about the issue of levy that have been forecasted on no basis. So I may say that the pressure is there, it can't be eliminated 100%. But the critical part that I've mentioned, the proper planning, somehow reduced that pressure. It reduced the pressure in what context? First, the priorities that have been agreed upon are the ones that are financed. So anything that is not a priority, which is introduced within the year, so you have the room to discuss. Because the minister cannot come say, this is a priority, this is a priority. Yes, it's a priority, but it is not a priority that was availed to be among the priority number one, because it was not part of the national planning, it was not part of strategic planning that was formulated. Number two, these things happens, the planning phase is concluded by that discussion between IMF and macroeconomic units back home. So again, it's to ensure that the forecast that we are doing is really realistic. Then sadly, we've got kind of that result-based framework. Revenue Authority back home, they work on targets. So there is just the threshold that they have to meet, But beyond that threshold, there is the payment that they get. For example, if you collected to this extent beyond the target, you are allowed to get this bonus. That one also motivates them to ensure that whatever they're going to estimate is possible, because they don't underestimate, but again, they are realistic. Where they are realistic, then the budget is more realistic. So what comes when there is, because economic performance may result in turn a negative aspect. So what happens? The first thing is that there is short-term financing mechanism. The first one, back home, we are still using the central bank overdraft. That one, maybe some countries are not using it, but we have the financing mechanism where you use central bank overdraft, but also is capped at a given level, because it will not be beyond 10% of domestic resources that you collected in the previous year. Number two, you have the treasury bills and treasury bonds that you can put on the market. Then number three, when the worst comes to the worst, you cut. So what to cut now? The issue is what to cut. So with the discussion we had in the morning of the commitment controls, the treasury single account is very important, because you can't release money. For us, we don't release money just for releasing money, sake of releasing money, but when money is needed. When you check from the bank account of a district, you find there is money, there's no release of cash. First, spend what you have, then release additional funds. Number two, we implement what we call zero balance mechanism. Those central government ministries, departments, and agencies have ability to have bank accounts. Those bank accounts are meant just for receiving operation funds. So once such funds are not yet utilized, you can't access additional funds at Central Treasury. Then finally, the commitment controls. It's very important, even that meeting where the national budget and accountant general meets together. Me, I'm happy because system have made all actors in public finance management work together. So today I have the Director General of National Planning who interacts with IFMI system, because all planning activities should be in the system. The national budget, they can't go and do the budget outside the national planning, because the system is controlling them, that there is no new activity that should be put in the system unless the one that was provided by national planning. Then finally, the action plan, procurement plan, and the cash flow plans are based to one system. So it's now easier to know how much is needed by this institution because of this action plan or this procurement plan. Then you balance. This institution doesn't need money. This institution needs money because of the procurement plan that I can be able to access and I can control. Then finally, what this national budget said from Uganda, the controls mechanism and accountability measures. So because the cash is bottleneck, we shall not get cash to send to wherever they need cash, but we need to ensure that wastage of cash are limited. There's one point that I've not mentioned relating to the centralized units. For example, the role of Ministry of Health when it comes for purchasing of equipment. It's not a health center that is going to purchase equipment, medical equipment, but there will be centralized procurement at the Ministry of Health. There will be centralized construction of schools at the Ministry of Education. Then you find that resources that you are decentralizing or you are just pushing down are limited. 90% of those resources will be salaries. They are controlled at the central government, and they are monitored because they should be paid on time. The last part that we mentioned is how much local government is able to collect. So before we used to decentralize even the collection process where they collect, but you could find that it became a kind of the control mechanism for collecting those resources were not as strong as the one at central government. Then what we did, Revenue Authority, Rwanda Revenue Authority, now is working as an agent for collection of revenue of local government. They have enforcing power, they have systems, then at the end we find that revenues that were collected by local government is somehow doubling because they have mechanism, control mechanism, they have capacity to collect those resources. Otherwise, challenges are there when it comes for cash management, but we deal with those challenges as dealing with any other shock that may happen. In the conclusion, it's factual, but it's result-based. You need to work to ensure that you can achieve what you want. Thank you.
Thank you, Marcel. I want to hear from these two on the issues of strength of PFM versus flexibility. I mean, flexibility only if PFM systems are strong.
Yeah,
Or strong enough.
I want to make a very brief comment actually on that.
I'll come to you. No doubt. And you'll have the concluding word.
A brief comment on that issue of the strength of PFM, and unfortunately, my brother has left. But I think that this is quite an interesting conversation, having been involved in this discussion for many years. It's an interesting attitude I get from colleagues from Treasury all the time, is when you ask for flexibility, Treasury colleagues always, and with a lot of respect for people working in Treasury, they have this attitude that they're the only ones who can protect public funds, and any other public servant has an intention of misusing or misappropriating public funds, including on matters where Treasury have no understanding of what should be prioritized on. And why I'm saying that is, when we were at the story I highlighted, when we did when Danida did the cost pilot, it was, there was a general agreement, and it's no brainer that the big expenditure items, salaries of health workers, essential medicines, and major infrastructure are done centrally. So you don't send money to facilities to do that, because you need higher level capacity to be able to execute that. But the monies that were going were really very minimal amount of money for day-to-day operations, paying electricity, paying your water bills, paying the non-technical stuff, buying cleaning agents. And it was to the tune of between probably about $300 to $500 in a quarter. And how Danida designed it, they only designed it with about 3 accountability documents or accounting documents for the health worker who are managing that fund. And it worked very well over a period of 5 years. When we went into the national scale-up and Treasury were involved in designing that, Treasury introduced 13 documents for purchasing, just going to the local shop to buy soap to clean surfaces there. You account, and they are asking for this nurse health worker for 13 documents. So it took us a lot of conversation in trying to convince Treasury that you're actually missing the point. Because first, the money we are talking about is very minimal money, but it's extremely essential for service delivery. And the people who are doing it with the best intentions for health outcome. But also importantly is the involvement of communities in the processes of that. And it's quite interesting that colleagues in Treasury don't have any faith in other public servants, and even in communities who are the taxpayers themselves. I think I'll let it there.
You want to further comment on that point?
Yeah, I think that's quite interesting, and it's unfortunate that Kenneth is not here. But of course, it's always good news to see that the funds are predictable now. And I know in Uganda they have changed the way funds go, so they come centrally and go directly to the facilities. So there have been a lot of changes that happen. But also going back to the question of who owns these public financial management systems, I mean, it shouldn't be one group of people or one ministry, the Ministry of Finance, that should sort of own these processes of making sure that funds are used properly, because that's really the most common argument for allowing for discretional use of funds or flexibility. We're not sure whether the other people can actually use the money in the right way, like you're saying. And I think that that's a discussion that needs to be had, and share the ownership for these management systems within finance. Because like in Uganda, similar to Kenya, we're not talking about very large amounts of money. And these monies, even if they're very small amounts, actually make unbelievable difference to service delivery and the beneficiaries. So I think it's very important that the people who make the decisions at the service delivery point have a certain level of flexibility, because one, the funds are not very big, but they make a very big difference if you move them from one intervention to another. which might be completely genuine because the national priorities for one district might not be the same as the other, especially in Uganda where you have over 170 districts. It's almost impossible for the national priorities to fit neatly in each and every district. Yeah.
Well, I'm afraid that the second round of question is going to be overbearing, but I want to also get back to Marcel because he wanted to give a comment on this very issue, the need to balance compliance with more flexibility. So tell us a little bit about that. And one thing I want to say is that I hope we're not back to this morning, but this discussion is also reminding me what Ratin was saying this morning. You know, is the Ministry of Finance like a librarian who doesn't want to lend the books or doesn't want to have mobile libraries? Or please.
Thank you. Actually, the question that I was asked, there's a question that was asked, since you worked with ODI, because ODI helped us to develop our current public finance sector strategy. So the challenge now was compliance or value for money. So the answer for this one, for us, this is the fourth PFM strategy that we're producing. And we are producing it now within the context of a country which is now looking not only for poverty reduction, but on a strategy transformation. So our national strategy is for it's national strategy for transformation. So we want to ensure the economic transformation. We want to ensure the governance transformation. We want to ensure the social transformation. Then now the issue is, what is the PFM strategy that is required for helping government transform in those different areas? So it's not that compliance part only. So we need to comply with the standard, with the rules and the regulations. Though colleagues are not happy with it, but the compliance that we're talking now needs to go beyond compliance. What is there? For example, we're saying, we used to say automation of system. Tomorrow we will be discussing the automation of the system. In the transformation agenda, it's not only having an euphemism, but how the euphemism is helping for decision making, the information we're getting. Number two, it's not only having a PFM system, but how that system is integrated with other systems. For example, we mentioned about the sector ministries, education. So we are not the expert in education matters, but we're an expert in the PFM matters. How do we link the system in education to the PFM system so that even we solve the issue of saying them versus us? Because now we're asking the education people, tell us the number of students. If we have the number of students, we release the cash toward those students. But the challenge has been, we don't know the student numbers, or even if they know, they just double the number because they want more resources. But now we are integrating the system in education into the financial management so that our controls are priced, then they get what they want on time. Number two, we had objective on capacity building, PFM capacity building. But the challenge is, if you want transformation, do you need just to go and learn capacity building programs the way you've been learning it? No. We're saying in the new strategy for transformation, our PFM approach to capacity building should be toward professionalization. If I'm an accountant, I should be a professional accountant. Where I go to London, I talk with someone who has got the CPFA. I go to India, I talk with someone who has the CPA. Number three, we were talking about cash basis of accounting, program-based budgeting, regularity audit, then the normal audit. But we're saying, since now we're talking about a national transformation, let's have a PFM that is going to be using accrual-based accounting basis, which is based to international public sector accounting standard. At that time, we will know that we are approaching the international context. Number two, when it comes for the audit, we are not going to only for regularity audit. We will be focusing on performance audit. Then when it comes for budgeting, it's not about input, activity-based or program-based. It will be now performance-based budgeting. When it comes for internal audit, it's going to be risk-based approach. Finally, approach to our government business enterprise. Most of the countries, especially where I know in Africa, they are cost centers. Government, we have public enterprise, but you find they are getting subsidies day and night. But it should be the cash generating units. So our approach now to public finance management reforms, it's more of ensuring value for money. So we consolidate the efforts that we've achieved in the previous strategy, but we look toward transformation, PFM practices that can help it to go where we want. Service delivery, value management, than just public financial management. Thank you.
Thank you, Marcel. Next chapter of the story, is it as good as you told it, is like in a year or two. I'm going to end here and just say thank you very much. Sorry for not having been able to take a second round of questions. I hope this session was interesting. And I need to hand over, I think, to Simon for the end of the day.
Just to say thank you very much, all of you, for well, a big clap for the panel and Catherine. Yes, just a big thank you for all of you for coming. I think particularly those of you who wouldn't count yourself as public finance professionals, because the whole purpose of today was to have a conversation. And it's great that you've come to the room. I hope we've been nice to you. We've been friendly to you. We would like to invite you to, we've got, I think, some drinks outside, a glass of wine or a soft drink, so you're very welcome to stay, and you're very welcome. If you run out of things to talk about your greatest failure. I've got loads more to tell you about. Maybe your greatest success, and if you're still short of things to do, decide whether Rwanda or Uganda or Kenya are the best exemplars of this agenda in East Africa. Okay, but thank you, and we'll look forward to seeing you all tomorrow. Thank you. Bye.